Hello there. Welcome to this week's case law review. My name is Clifford from Clifford Odhiambo and Company Advocates. We are located at Jumia Place along Lenana Road in Kilimani. You may have come across a story in the print or digital media of someone who has endured untold suffering resulting from clinical negligence. You may be watching this while contemplating lodging a formal complaint against a doctor or a medical institution because of the kind of medical care you received or a family member received. Well, given the significance of this week's case law review, we've segmented this episode into three. In part one, we'll focus on the court's decision, and what was not adequately addressed by the court will be featured in part two, where we'll focus on the issues of disclosure, consent, negligence, standard of care, and ethics expected of doctors and medical institutions. We'll conclude this episode in part 3, where we'll focus on how to institute a formal complaint or defend oneself against a complaint for clinical negligence. We kick off part 1 by analyzing a recent decision of the High Court of Kenya in the case of Joyce Mwonjiru Njuguna versus Maurice Wambani and eKLR Health Services. The citation of this case is Nairobi High Court Civil Case number 47 of 2011, 2022 eKLR. The judgment of the court was delivered by Honorable Justice J.K. Sergon on the 10th of March, 2022. The plaintiff in this case is the personal representative to the estate of S&M, now deceased. The first defendant is a medical practitioner and, according to the case, was among the primary caregivers to the deceased. The second defendant is a professional healthcare services provider where the deceased sought treatment at all material times. It is claimed in the case that sometime in September 2009, the deceased felt unwell and thus visited the second defendant hospital with complaints of difficulties in micturition and inability to completely empty his bladder. He was seen by a doctor who made a diagnosis of enlarged prostate and referred him to the first defendant on account of being the consultant urologist. The first defendant not only booked but proceeded to conduct a surgery on the deceased to remove the prostate. However, the surgery did not result in the much needed relief as the deceased noticed that his urine kept dribbling. He informed the first defendant, who assured him that the dribbling would stop, but it didn't. This prompted him to seek treatment from another hospital, which referred him to Kenyatta National Hospital, and while he was there, he elected to go back to the second defendant hospital, where he was yet again referred to the first defendant. The doctor in the case admitted that the deceased had chronic retention due to bladder outflow obstruction. However, the surgery that was conducted was for true-cut sextant biopsies with transurethral resurrection of the prostate. The doctor in the case further admitted to have instructed the deceased to expect some hematuria, dysuria, and dribbling of the urine, which was supposed to resolve within a week. However, this did not happen. The plaintiff complained to the court that the doctor never informed the deceased that he was going to cut a small channel to allow him to pass urine, or that his prostate was going to be removed. All the doctor informed the deceased was that he conducted a procedure better known as a cystourethropy, and that the deceased should learn to hold his urine so that his muscles might develop. For these reasons, the plaintiff held the first and second defendant jointly and severally liable for failing to exercise reasonable care and skill in the management and treatment of the deceased. The plaintiff persuaded the court to award the estate of the deceased Kenya shillings 5 million for the pain and suffering that the deceased underwent, together with 1.5 million for the incompetent surgery, on top of costs for this particular suit. He further testified in court that the deceased told him that he underwent a second surgery and he feels that this was the correct step taken and that the incontinency developed after the surgery. The first defendant doctor took to the dock and testified that he had told the deceased, in keeping with such surgeries, that the dribbling will continue, but he could not guarantee for how long it will end. That this was a common occurrence in advanced prostate cancer disease patients, such as was the deceased. The doctor argued that he was not to be blamed. In any event, the deceased had signed a consent form in which he had agreed that should a dribbling occur, it did not mean that the surgery was incompetently done. From the hearing, it emerged that the doctor had performed a sextant biopsy of the prostate, which was initially never authorized. The operations note indicated that the doctor had performed 2 surgeries, one that was never authorized and a TURP that had been authorized. In his defense, the doctor argued that a doctor is not negligent merely because something goes wrong, but a doctor will be negligent if he falls short of the standard expected of reasonable, skillful medical practice. The true text is in making a positive finding of such failure, as no ordinary skilled doctor would be guilty of negligence if he exercised reasonable and ordinary skills in offering medical care. In countering the arguments made by the doctors who testified during the hearing, the first defendant doctor argued that the burden of proof of medical negligence usually rests upon the plaintiff, except where the facts are so obvious so as to shift this burden of proof on the doctor, who now has to prove that his own negligence did not contribute to the complained of state of affairs. He further argued that the failure to effect a cure or obtain good results is not sufficient enough to make an inference of negligence upon the doctor in terms of the diagnosis made or the treatment adopted. It was the conclusive findings of the court that in conducting the sextant biopsy, the doctor injured the deceased, thereby causing the incontinence in his urine. The court also established that the hospital owed the deceased a duty of care of ensuring that the doctor had the requisite expertise and skills. The fact that the deceased was still in diapers and dribbling meant that he did not receive the best possible care from the defendants. For these reasons, the court proceeded to award his estate the sum of Kenya shillings 4.5 million as damages, together with the cost of the suit. This case leaves many fundamental questions unanswered, like what constitutes reasonable care and skill in treatment, or what is the impact of signing a consent form before undergoing a medical treatment or procedure. To answer this and many more, please stay tuned to part 2 of our segment on medical negligence. For now, see you later.